and that will really help to suppress and ultimately control the pandemic in the continent. Of course, the number of cases in the African continent is still small, but that doesn't mean that it will continue the same way. It may change, but the approach you're using can help in suppressing and controlling it. And what we're saying from WHO side is to continue to do the same, but more aggressively, and more aggressively hoping, expecting that this could get even, the problem could get larger. Thank you.
Thank you, Dr. Tedros. We're running out of time, so I'd really ask all the questioners to try to keep your questions short to give other people a chance. Now, the next journalist on the line is Pranay from ABP News in India. Pranay, are you on the line?
Yeah, I am online. And my question is to panel that, India is seeing the surge of the cases right now. You pointed out about the aggressive testing and the aggressive strategy in this match against coronavirus. How do you suggest and what is the WHO's observation about the situation in India? And there is a shortage of kits. So how WHO is going to help the second most populous country on earth?
So this is a question that we received from a number of countries that are really facing some increase in case numbers, and the questions are around how do we best use the resources that we have. So we've been very clear in our messaging that to fight this, we really need to find all of the cases. We need to know where the virus is so that we can tailor our approach to the areas that need it most. And to do so, we need to find the cases. So we need to be testing the suspect cases and testing those contacts who develop symptoms. When the situation gets when the outbreaks become large and resources become limited, we have recently put out some guidance around how to make some choices about where testing can be used, first and foremost, to really understand where that outbreak is, to find patients who are most severe so that they can have treatment. And I wanted to, this binder here is our binder of guidance that we have put out, that we have developed. Our first package of guidance came out on the 10th of January, and since then we have been working across the globe with all of our member states, our regional offices, people working in labs, clinicians, IPC specialists, modelers, to try to tailor our guidance to best support countries according to the 4 C's, according to if they have no cases, if they have sporadic cases, if they have clustering of cases, and if they're facing community transmission. And what we're trying to do through our guidance, and we need you to look at the guidance in full. Our press conferences are ways in which we can highlight some of these key aspects to our guidance, but the real detail is what's online. We know not everybody is going to read that, but those that do need to read that, who are taking decisions in countries, please look at that in full, because we have detailed information there that can provide and help you make decisions to make a tailored approach, all with the goal of suppressing transmission and ending these outbreaks. But there are some decisions that may need to be made in certain countries where resources are scarce. At the same time, we are working very hard with manufacturers who are developing test kits and the supplies, the supporting supplies, to be able to use those test kits. We are working with countries to increase the number of labs that can actually run these tests. So there's a multi-pronged approach in terms of how we can support countries through our regional offices and our country offices to build and increase that testing capacity.
If I could just possibly add specifically on India. Obviously, India, like China, is a hugely populous country, and the future of this pandemic, to a greater extent, will be determined of what happens in very large, highly populated, densely populated countries. So it's really, really important that India continues to take aggressive action at the public health level and at the level of society to contain, control, suppress this disease and to save lives. India led the world in eradicating 2 silent killers, or eliminating them in the country. Smallpox, one of the greatest successes of mankind, a virus that killed more people on this planet than all the wars put together. India, through targeted public health intervention, ended that disease and gave a great gift to the world. India also eliminated polio, another silent killer, and did a tremendous job on surveillance and finding cases and vaccinating and doing all the things that need to be done. So India has tremendous capacities. All countries have tremendous capacities. When communities are mobilized, when civil society is mobilized, when, as the Director General says, heads of state and governments drive an all of society approach. There are no silver bullets here. There are no easy answers. If there were, we wouldn't be having to work so hard. We've got measures we can take now while we wait for other solutions, and we must take them now. So it's exceptionally important that countries like India lead the way and show the world what can be done, and do as they have done before. Show that aggressive, sustained public health action from community right the way through to the head of state can have a profound effect on the trajectory and the outcome of this pandemic.
Thank you, Dr. Ryan. The next person on the line is Peng Wei from the People's Daily. Peng Wei, are you on the line?
Yes, thank you. Can you hear me?
Very well. Please go ahead.
Yeah, thank you. This is Peng Hui Zhang with People's Daily of China. Some American officials, including Secretary of State Mike Pompeo, criticized China for its handling of COVID-19 in the early stage, and continue to call COVID-19 virus as Wuhan virus or Chinese virus. So what's the WHO's comment and position on that? Thank you very much.
I think we've spoken on this issue at a number of press conferences, and I think WHO's position on this has been clear in the past, and is clear now. And I think at this point it's not a core issue, and it's an issue that, quite frankly, is a distraction right now. So I think we need to focus on what we need to do now. There is no blame in this. There's only a future, and we choose the future, and we have capacities to fight this virus. It is affecting, as the Director General said, almost every country on the planet, every population. And it's not just communities, it's everyone can look around at sons, daughters, mothers and fathers and see who's at risk. We need to fight this thing together, and I will reserve any comment for later regarding blame.
Thank you, Dr. Ryan. And now we have Gabriela from Mexico on the line. Gabriela, can you hear me?
Yes. Thank you for taking my question. Gabriela Sotomayor, Mexico, Proceso. Dr. Tedros or someone on the panel, if they can answer, how far behind is testing versus the real spreading of the virus? I mean, is it 10 times, 100 times? What is your estimate? Are we only looking at the tip of the iceberg?
So thank you, Gabriela, for the question around testing and highlighting the importance of testing. So with any new virus, I think what is the most tremendous story here, and I don't think any of us have ever seen the speed at which testing has been developed for a novel pathogen. So as you know, this new virus was identified within days. The sequence was shared a few days later, and because of that, testing began really across the globe. And with the sharing of the sequences on public platforms, labs all over the world were able to develop assays And in doing so, the amount of production for testing grew exponentially across the globe. Of course, we always need more testing. Of course, we always need more labs, but that's the case for every pathogen, especially an emerging pathogen. What we are seeing now are countries finding ways in which they're trying to improve the production, the availability, the access, the sharing of these assays so that more testing can be done. And what we need are all countries to be focusing on testing as part of a comprehensive strategy. And we've mentioned what that strategy entails. That strategy includes public health measures, it includes physical distancing, it includes a strong government approach, it includes mobilizing the population, it includes every single individual knowing what they have to do to fight this pandemic. And we've outlined what that is before. And testing is a critical part of that. But every day we are looking for ways in which production can be increased, in which more labs can be available to do those testings, and that testing can be done faster so that we know where this virus is and that we can fight it without being blindfolded.
And again, just to qualify that the virus was isolated on January the 7th, and the whole genome sequence was shared with WHO and the world on January the 12th. It's just 12 weeks, or 10 weeks ago, sorry, not even 12, 10 weeks ago since we had a genetic sequence of this virus. The fact that so many tests are out there, the fact that there are so many testing platforms available is a remarkable success for science, for collaboration, and for public-private partnership. So, yes, of course, it is very difficult to go to absolute scale on testing, while at the same time maintaining quality and maintaining the validity of these tests has been extremely important. So, the question you specifically asked, there's no question in some countries that all cases have not been detected, and that's been the case in most countries. But what we've seen is a huge catch-up in testing in most countries, and we want to see more. We do say, and the DG has said before, test. But again, we're not talking here about testing everybody in the community. We need to focus on two priorities: making sure that suspect cases are tested. That is absolutely the central priority, and obviously that people presenting in hospitals with clinical symptoms of pneumonia who are entering the system are also tested as a priority. They would also be suspect cases. We would also like to see contacts of cases who are unwell or are showing symptoms, that they also be tested. The measures we have in place now, or many countries have in place, of movement restrictions and people staying at home and physical distancing, all of these measures are helping to, in some senses, dampen down, push down the intensity of the epidemic. But if we have to work our way out of this situation, as we gain some success with those strategies, we have to be able then to identify who is infected and be very, very quick and agile at identifying who's infected at community level and ensuring that they are isolated. So testing is important now, but testing will become even more important in the coming weeks, not less important. So we all have to work hard. We're working very, very hard with both public and private sector partners, as are all governments, to scale up and make testing more available and to push testing right down through the system. But that has to be done with an eye on quality and ensuring that those tests are the best and highest quality.
Thank you, Dr. Ryan. I now have, we're really running out of time, so only two more questions. We'll take one from Kai Kufferschmidt. Kai, are you there?
Yes, thank you very much for taking my question. I wanted to ask about the strategy that we're seeing in some countries. UK has talked about it, the Netherlands are suggesting it. And they're basically trying to find a balance between shutting everything down to suppress the virus and letting it spread at a very low level in order to have some semblance of normality. I'm curious whether the WHO, you've talked very little about the end game because you're concentrating on what's happening now, but I'd really love you to address a little bit how you see the future, for all of these countries that are in a shutdown now. How do you see this proceeding?
Thanks, Guy. You are correct that this is a very, very important issue, because as so many countries around the world have gone into this mode of people staying at home, of movement restriction, countries are obviously and justifiably concerned of the social, psychological and economic impacts of those moves. Countries are doing their best to suppress infection and take pressure out of the epidemic and, more importantly, off the health system. But we do know that that is very difficult to sustain. And therefore, how are we going to turn that around? And the DG said it. How do we move from what is a defensive mode into an offensive mode? How do we move from trying to avoid the virus to actually going after the virus? We've seen this in Ebola, we've seen this in polio. There is a moment at which you have to step forward and go after the virus. In order to do that, and we've seen examples in places like Singapore and Korea where governments haven't had to shut everything down. They've been able to make tactical decisions regarding schools, tactical decisions regarding movements, and been able to move forward without some of the draconian measures. But they've only been able to do that because they've had another weapon, and the other weapon they've had is highly aggressive case finding, contact tracing, community surveillance, isolation of cases, quarantining of contacts, testing of contacts if they get sick. They've put together a comprehensive public health toolkit which they're able to match with their more society-wide measures like movement restrictions. And we're working extremely hard. Our Strategic and Technical Advisory Group for Infectious Hazards is working with us right now, looking at those strategies to move forward from where we are now. And governments need to use this, to use the DG's word, second window of opportunity. All that we get from movement restrictions and people staying at home and all of these measures, we buy some time. We take the heat out of the epidemic or the pandemic. We buy some time. But we then need to find strategies and tactics that get us to move forward. And we have to make those decisions. Each government will have to make those decisions. We're working hard to provide advice to governments on how to do that. But very, very clearly, in order to move forward, a scale-up, and I mean a massive scale-up, in public health capacities to do case finding, isolation, quarantine of contacts, and being able to go after the virus rather than the virus coming after us is one of the key ways we can move forward. And we'll be coming back to governments and in public around our advice on this to governments. There is a very, very precious window now in which we can prepare to do that.
Thank you very much, Dr. Ryan. And our last, but certainly not least, we have Helen Branswell.
Oh, thank you very much for taking my question. This is probably for Maria. People are reporting a loss of a sense of smell. I don't know how frequently that's been seen. Can you give us any indication of whether that is actually a reliable marker of infection?
Yes, so yes, we've seen quite a few reports now about people in the early stages of disease may lose the sense of smell, may lose the sense of taste. But this is something that we need to look into to really capture if this is one of the early signs and symptoms of COVID-19. We have a number of countries that are conducting early investigations where they are capturing standardized information from cases and contacts, where they're looking at signs and symptoms is one of the features that they're looking at. These early investigations, and we've published protocols on our website of how to conduct these, and we have over a dozen countries conducting these. It's called the first few X, the first few hundred cases, where there's a systematic data collection using molecular testing, using serologic testing. As you know, these serologic assays are being developed, where we systematically collect information on signs, symptoms, on clinical features, where we can capture this more robustly. But we are reaching out to a number of countries and looking at the cases that have already been reported to see if this is a common feature. We don't have the answer to that yet, although there's quite a bit of interest in this online. There are likely to be many signs and symptoms that people have. We have a good handle on what the major ones are, and those are fever, this is dry cough, this is shortness of breath. And of course, other features would be aches and pains. Some people have headache. Very few, between 3 and 5%, will have gastrointestinal symptoms. Very, very few will have a runny nose or sneezing. And so a loss of smell or a loss of taste is something that we're looking into. And we're looking forward to the results of these early investigations that are being conducted by a number of countries so that we have a more evidence-based approach and we can add that to the list. Thanks.
Thank you so much, Dr. Van Kerkhoff. We've unfortunately run out of time, but to all the people who didn't get their questions answered, please come to our website, www.who.int, or write to mediainquiries.who.int. We are working 24/7 and we will answer your queries. And the next
And there you have that update from the WHO around the measures that are being taken to ensure that we contain the spread of the virus. Quite a number of issues that came out of that press briefing, including what Dr. Michael spoke about, and that is that countries must take an aggressive approach in terms of trying to contain the spread of the virus. And I wonder whether this evening at 7:30, when the President addresses the nation, whether the measurements that he will be announcing are as aggressive as expected by the WHO.
And just looking at the WHO, the information that it's released, it seems very interesting. Obviously, we know we now have 402 cases. That brings Africa's COVID-19 cases to over 1,600.